A lot of times families ask, what can I expect? What happens to patients after they've had a stroke or brain injury? But also if you're a healthcare professional and you're trying to think of, well, what are all the things that happen to somebody after a stroke or after a brain injury? It can be difficult to come up with those. What are the questions I'm supposed to ask, particularly if you're a relatively young healthcare professional? You may not be ingrained about all the questions that you should ask and inquire. And I always like to put things in three buckets. So everything that happens to the brain can go into three buckets, whether it's been a stroke or a brain injury. And those three buckets are physical problems, cognitive problems, and behavioral problems. So if I'm going to ask Mr. Smith questions, I can think, okay, first bucket's physical. I'm going to ask questions about paralysis, numbness, trouble swallowing, vision, and think about the physical aspects. The second, which we frequently forget to ask about, are the cognitive problems. Do you have problems with memory, with concentration, paying attention, paying the bills, menu preparation? Grocery shopping and preparing a menu is a very complex task. And the last bucket, which we frequently ignore, are the behavioral aspects. I have another one of these videos on what's the most important question to ask. Is mom different? Is dad different? Any problems with depression, anxiety? Do they act differently than they did before? So remember, anybody who's had a stroke or a brain injury or anything happen to their brain, inquire the three buckets: physical problems, cognitive problems, and behavioral problems.